Hi, this is Dr. Jonathan Youssef, Networking for Your Optimal Health. Today's topic is going to be about cholesterol. So, if you're here, most likely you were just told that you had high cholesterol. You're kind of wondering, what are you going to do about that? What does it all mean? So let's start off with your basic panel. So not everybody does a basic panel, but most doctors are doing your basic lipid panel. And that includes your total cholesterol, your HDL, your LDL, and your triglycerides. Most of my patients are seeing their total cholesterol is high. And so a lot of people are just comparing with others and saying, okay, my total cholesterol is less than 200 or my total cholesterol is above 200, so I have high cholesterol. Well, they need to break it down into the H, which is the happy cholesterol, the good cholesterol. There is good cholesterol out there that actually takes large, buoyant HDLs and roars through those coronary arteries and helps clean out the plaque. So there's actually good cholesterol out there. And if you have more good cholesterol than bad, that total cholesterol might be deceiving. So what is the bad cholesterol? Bad cholesterol is the LDL. L, we think of lousy, bad cholesterol. We also receive an information about your triglycerides. Your triglycerides are almost often found in foods that are carbohydrates, sugar. They also could be in fats as well. But triglycerides are most often the first thing that kind of goes up since your recent meal. So if you've had some bad food recently, or you've been drinking some alcohol, and you drank and ate right before you did your blood work, like maybe the night before, well, that triglycerides are going to be high. So the LDL is the only item that is actually calculated based on your HDL triglycerides. How do we calculate your LDL? In other words, your LDL, which is the worst one, this is the one we use for most of our information, is actually a combination of HDL, the good cholesterol, your VLDL, another bad cholesterol. You add them together and you minus it from your total cholesterol. So what I'm trying to say is the real numbers that we're looking at, triglycerides, HDL, total cholesterol, but the LDL is the one we use to determine if we should put you on medication. So this is your basic panel. I'm going to talk to you guys about something called advanced lipid profile, which is something in another topic, but for right now, this basic panel is what 99% of primary care offices are doing. Once we've determined that your LDL is high, which is what you've been told, now we're trying to talk to you about some natural options, some prescription options, and then we're looking at your risk factors to determine if you should be on those prescription medication. I'm going to talk a little bit about prescription medication because once we find that your LDL is too high, now it's different for everybody. If you're a diabetic, if you have high blood pressure, if you have high risk factors, your LDL might need to come down a lot lower than an average person. But let's say 100 is the number we're looking at. We want to get that LDL less than 100. So what we do to determine if you should be on medication or should we just leave it go is one, there's multiple factors, by the way, and you have to talk to your physician and doctor. If you're part of our program, you're already talking to me and we've already had a conversation, but also you might want to go into detail as to what's going on. Look, this is how we determine it. We use something called the ASCVD, atherosclerotic cardiovascular disease score. This is your 10-year risk score of having a cardiac event. Means that we're looking at your age, if you're a smoker, male or female, your HDL, happy cholesterol, the race, your treatment for hypertension, especially if your systolic blood pressure is high, your total cholesterol and diabetes. When we get that score, okay, which is usually if it's 7% or above, we're thinking, hey, you're an intermediary risk for cardiovascular events. Hence, we want to start you on a statin. Now, everybody's complaining statins, cholesterol medication, Lipitor, Crestor, Pravastatin, Simvastatin, Zocor. These are prescription medications we write every day, and there's good evidence that these are going to prevent heart disease. They have shown in prevention of strokes. So there are a lot of good things happening with this is life-saving medication that we haven't had before. However, comes with some side effects, and not everybody wants to take them. Liver enzyme elevation, muscle aches and pains called myalgias, and there has been some concern about some cognitive function decline in elderly patients. So something to think about before we start to put you on that. We're looking at your risk factors. Now that we've gotten to the majority of the patients who are looking at these statins, there are other medications that have come along, something called a PCSK9 inhibitors. There's Repatha and Pyrolent. These two are injectables. They're usually every 2 weeks. And what they use is this new method called monoclonal antibody technology to target the PCSK9 receptor, which this receptor in the liver gets broken down, and what happens is we don't want that to be broken down because it's what takes the LDL out of the bloodstream and into the liver where it gets rid of it. So basically this is your body's way of getting rid of LDL, and now we're helping that by focusing on the Repatha and Pyrolent, these monoclonal antibodies. There is another product called Zetia that maybe is not as powerful. However, for some patients who cannot tolerate some of the other medication, this is great because it stops the absorption of fats. Now, one of the things that happens is this still affects the liver. So statins and Zetia can be used together in combination to get an ideal LDL reduction. However, you may want to use Zetia by itself if someone cannot tolerate statins. However, Zetia still affects the liver, so you may still be in the same boat. Now I'm going to talk to you about some natural options. One of our students was kind enough to put this up. Looking at bergamot is one of the options that we've had in our office recently. We actually recommend some of these prior to starting prescription medication only because some patients want to have something natural. 2 is that they may feel they're young. 3 is that maybe they don't have that ASCVD score high enough. So I'm going to have Melissa mention some of those for us right now and help us through the natural supplementation.
Hi, so like Dr. Yusuf was saying, some people want to try the natural before jumping to a prescription medication. So we have bergamot, we have red yeast rice, CoQ10, omega-3, niacin, flaxseed, and psyllium. So the CoQ10 is a good one for if you are taking a statin as well. It helps with the side effects. The omega-3 is good for decreasing triglycerides. And then niacin and flaxseed both help to improve the HDL, so that's the good cholesterol. The psyllium, or any fiber in general that you're eating, is good because it helps bind the cholesterol and get it out of the body. Fun fact, the psyllium also helps with your blood sugars.
Excellent, excellent. Well, thank you guys. These are some things that we can talk to you more about, and we're going to go into some specifics because this is a whole large topic that we spend hours and hours on. So this is Dr. Jonathan Yusuf. Thank you, and we'll see you soon.